New Disabled South presents.
Because that's the system. That is what real people in Louisville, Kentucky are experiencing on the day-to-day. And they're not the only ones. There's dozens of more stories just like that of people who couldn't get access to the care they needed, couldn't navigate the system, couldn't find anybody to trust, couldn't figure out what to do, and they fell through the cracks, and it cost them their lives.
In Kentucky, the rolling hills are dotted with deep poverty, and the intent of expanded Medicaid meets the reality of complex bureaucracy. Here, dual eligibility reveals a dangerous gap in care. Kentucky expanded Medicaid in 2014, one of the first states to do so. While adding more coverage for low-income families was a critical decision too many southern states still reject, Medicaid expansion isn't a perfect solution. For those trapped in the dual eligibility system, a fundamental problem remains. Two systems that weren't built to work together, Medicaid and Medicare, still don't. Kentucky rightfully expanded coverage, but coverage without full access for vulnerable populations is a promise unfulfilled. For 25 years, Jen has navigated the maze of Medicare and Medicaid. She's been in therapy, residential care, institutionalized, in and out of outpatient facilities. She's one of the lucky ones. She knows how to advocate for herself. She has a support team. She's alive, but she's also a witness. To friends who couldn't decode the system in time, to people who died waiting for care they qualified for but couldn't access, to a system that demands so much energy to navigate, there's precious little left for healing. This is what happens when healthcare access becomes a test you can fail, despite the best intentions. In the dual eligibility trap, the penalty for confusion can be death. Here, care is rationed, information is hoarded, and thousands face true peril. I'm Stacey Abrams, and this is Dual, the true cost of care.
Dual, the true cost of care. A balancing act of epic proportions.
Jen's story begins like so many others, with work her body couldn't sustain.
My story was pretty tumultuous, but I've never been able to keep a job, for as long as I can remember. And I started working when I was 17, and I got fired from many jobs for not being able to keep them for unknown reasons.
What followed was a cascade of crises that the system wasn't built to catch. A pregnancy, family conflict, and a moment that would change everything.
My dad was kind of like, well, if you don't like this, you can leave. And he doesn't understand to this day that I take that stuff as a dare. You tell me that, I'm Gen X, I'm gonna leave. So I left with a 6-month-old kid in tow. And I went to the shelter. Things progressed. I couldn't keep custody of the kid. I had another kid in the middle of all that. Couldn't keep custody of the kids. So I gave up my custody. And I was in a 2-year transitional program, which they were gracious enough to let me stay even without the children, which was nice of them. They didn't want me homeless.
It wasn't until she was 25 that Jen found her way onto disability, both SSDI and SSI. Here's the difference. SSDI is Social Security Disability Insurance, based on your work history. SSI is Supplemental Security Income, which is for people with limited resources. When you qualify for both, however, they don't add up. Instead, they offset each other, dollar for dollar, with neither being enough.
I was still young. I was 25. I hadn't made enough to just be on SSDI. So some people, they fall into that gap where they can be on both SSDI and SSI at the same time. And I did. I only collectively, I only had about $764 on my check, which is a lot.
To understand why this matters, we turn to Dr. Carrie Graham, a health policy researcher who has spent decades studying Medicare and Medicaid.
If you are dual, or you might hear the term Medi-Medi, it means you have Medicare and Medicaid. There are two programs that were not meant to work together. And the people who are on both are people with something like an average of like 3 or 4 chronic illnesses.
But Jen's real education came through trial and error and almost losing everything.
So eventually I worked enough over the years to where I only got SSDI. That was actually over the pandemic when all that happened. And then they played this game of where, now you're on Medicaid, now you're not. Now you're on Medicaid, now you're not. It happened a couple times. Then with the expansion of Medicaid due to the Affordable Care Act, I qualified for Medicaid still. I didn't find this out. Like, my workers kept telling me, hey, we don't understand why they're taking you off Medicaid because you still qualify it. I'm like, how? The people there at DCFS are telling me that I don't qualify for Medicaid. So I didn't know who was right. But then I met an insurance guy who said, Medicaid has levels. If you're within this income bracket, you can still get Medicaid even without this state-specific benefit.
That insurance agent's intervention was crucial because for Jen, Medicaid goes beyond basic insurance. For her, it's the difference between independence and institutionalization.
Part of the reason I wanted to get on the state supplement, aside from the fact that at the time I was doing so poorly, was to get that Medicaid benefit so we could pay for all the support team that helps me. When you want to look at it in terms of the big picture, I am one of the fortunate ones. And a lot of this is because I advocated for myself. And not everybody is capable of that. And I think this is one of my aggravations with the system is people fall through the cracks simply because they cannot internally match their emotions with what's going on to give voice to their needs and whatever. And it was insanely difficult for me to do at the time. So I can't imagine somebody who's going through all this and just like, look, I need help. And they don't know what to tell them what kind of help they need. It's exhausting. Like, you have all this life stuff going on, right? And on top of all the life stuff you've got going on, you have to advocate for yourself. Then you've got to do daily chores. And I suffer from exhaustion and sleep deprivation and sleep disorders. Some days I wonder why I'm still doing all this, because the life satisfaction you need to promote yourself in this, to get yourself to move to the next level, is not always there.
For 25 years, Jen has been learning to walk this tightrope, a path everyone understands she didn't choose and can't detour from. Instead, she travels it daily knowing that one misstep, one missed deadline, one confusing rule change, and she could lose everything.
The more I push, the less I can sleep.
Over 25 years, Jen has navigated the worst versions of the system she can't escape. The institutions, the denials, the dismissals.
I started therapy when I was like 7. I went into residential care when I was 25. I've been committed by the state of Virginia. I've been in and out of inpatient, outpatient. I'm in a day program now.
Getting properly diagnosed took decades, and that delay cost Jen support.
It took them 10 years to diagnose my diabetes. I literally had a woman doctor tell me to my face that I was being psychosomatic. I got diagnosed with autism in 2022. I have never had autism support. Sometimes when I get upset or whatever, I can't really put ideas together to tell people, hey, I need this. And so, like, trying to explain to my workers that, hey, I need these supports. And they're like, well, what supports? And I'm like, how can I explain to you what I've never had?
This late diagnosis after age 21 meant Jen was locked out of services. It's a common story, especially for women.
So if you get late diagnosed, because a lot of women these days are getting late diagnosed because the criteria was originally more geared toward men and not properly geared toward women. So yeah, we're going through all these things as if we don't need the support because you aren't diagnosed toward later. So it must be means that you're coping very well. But I have a whole host of records that are contentious to that.
The complexity of the system isn't a bug of the design. Folks like Jen have every reason to believe it's a feature, one designed to limit use and usefulness.
I believe it is. They've made it intentionally difficult and not user-friendly from way back since whenever hysteria was a diagnosis for women. That is still sort of, in some ways, the way we're treated today. In a lot of instances. They won't listen to you, especially if you're a woman, especially if you have a psych diagnosis, until things get bad or until you say it enough times or whatever. I'm pretty burnt out these days. I'm to the point where I just don't want to bother with it because the more I push, the harder I push, the more tired I get, the less I can sleep at night.
Despite having both Medicare and Medicaid, Jen lives with constant fear.
At this stage, there's a part of me that feels like we're racing the clock in terms of keeping benefits. I'm trying to do everything I can to get as healthy as I can and in a better position in case I'm forced to transition away from all of this, which, God forbid, I think that would be a nightmare for me right now, but
Medicare covers her medical needs like her insulin, her continuous glucose monitor, her doctors. But it's Medicaid that makes independent living possible.
Medicaid pays for my payee in that same office of that same program. My therapist, my the peer support that comes to my house, a life skills lady, that they pay for all of that out of that same program. As much as that's hard for me to juggle some days, we wouldn't have gotten to this point without the continued support.
Dr. Graham explains why coordination between these programs is so difficult.
If you're a dual, you should not be getting a bill, but the two programs can't coordinate. One's regional, one's federal, one's, they just don't coordinate.
Falling through the cracks. Content warning. This section contains discussion of substance abuse and suicide.
The system of federal and state healthcare, of mismatched rules and regulations, creates a product that actively traps people in poverty.
You're only allowed to make so much before they cut whatever benefits. It's bullshit. Like, you cannot really survive in this system unless you're lucky enough to get housing and both Medicaid, Medicare, like other stuff, food stamps, stuff like that. And, even with all that, you have to have substantial access to food banks and stuff like that.
The numbers tell the story. SSI recipients can't have more than $2,000 in assets a limit unchanged since 1989. In Kentucky, the Medicaid income limit hovers around $1,600 a month. Meanwhile, the average one-bedroom apartment in Louisville costs $1,200. Do the math. The system demands poverty.
And I find myself doing that a lot these days. I have to swap the time I need to dedicate to my mental health to get well for services or doctor's appointments or getting food, stuff like that, instead of just being well.
But Jen isn't just speaking up for herself. She's speaking for the friends who didn't survive the realities of a system that defies logic, like John.
A dear friend of mine who passed away. His name is John, and John was a very good friend of mine. And John had just gotten off the streets. Like, we all urged him to go get disability and whatever. So he did. He got his disability. He had just gotten off the streets. But then he got sick. They had found out years of bad diet, whatever, from being on the streets and eating soup kitchen food. And he had developed diabetes. The diabetes had gotten so bad that it went to his heart. John got sick, and he was staying with somebody I knew. And he couldn't get treatment in time, so it killed him. We watched him, me and my other friend watched them pull the plug on him. The reason I'm telling this story is this, if they had made the system simpler to use, he might have gotten off the streets in a more reasonable amount of time, gotten the appropriate care he needed, and we might be sitting here talking to him today.
And Kentuckians like Spike, who couldn't find the support he needed.
Another good friend of mine he went by Spike. Spike was on the streets. Spike had an addiction problem. He struggled. Good guy, real sweet guy. These things don't exist in a vacuum. You have to have support to get off of drugs. And Spike, because of his experiences and whatever, couldn't find people to trust to help get him through so he could make better decisions, get off the streets, and become the person we all knew he was. And he ended up killing himself on a heroin bender.
These stories of loss aren't just isolated tragedies. Jen, Spike, and John's stories reflect systematic failures repeated across the state and around the country. Because while dual eligibles make up just 17% of Medicare beneficiaries, they account for 33% of Medicare spending. Not because they're taking advantage of a generous program, but because by the time they get care, they are sicker and the process gets harder. This is what Jen sees every day. People sharing what little they have because these programs fail to provide what they need. What gets decried by cynics as fraud or waste and abuse is more accurately described as bureaucratic gatekeeping that locks those out we swear to serve, which leaves the vulnerable to fend for themselves.
Yeah, that's what we do. A lot of us who are in this position, we feed other people, we spread information, we house other people, and then the system says, well, you're housing other people. So I'm like, yeah, motherfucker, if you wouldn't house them, maybe we wouldn't take up for them so much.
Jen rejects the gatekeeping, determined to share what she knows. But she faces obstacles that are not designed for one person of good intent to overcome.
Inclination is to, when I get information that's beneficial to people, I'm gonna pretend it's wildfire and I'm gonna spread it like a motherfucker. Like it's a goddamn STD and let everybody get in on this information. So when I was in a homeless shelter way back in my 20s, I got a piece of information. So I did what my little ADHD self was going to do. I spread the information. One of the people that work there got really angry because I was giving out information and they don't like that. Way back in my 20s at that shelter, they wanted to be the purveyors of information so they could keep certain people out of using it and let certain people in. And I just don't think they should be in control of that. I think we should be in control of ourselves, and everybody should have access to that because they know their lives the best on when they need stuff and when they don't.
Now in a different environment, Jen continues to share what she knows.
I believe in empowerment. I believe in, whatever is free should be free to give and free to use and whatever. And everybody deserves it because everybody needs the support. I don't, even people who have means do need a little bit of support every now and then. So a little information goes a long way.
Kindness matters.
Jen has been navigating dual eligibility for 25 years. She's one of the lucky ones. She has housing, a support team, and the ability to advocate for herself. But she lives with the constant fear that it could all disappear.
The Orange Palpatine is making orders and working with Congress to make cuts to programs like Medicaid and Medicare. So from what I've told you, Medicaid covers services like social workers and case managers and home care and stuff like that. Realistically, when they say they're going to cut Medicaid, they're making cuts to things like they want to talk about how they want people to go to work and stuff like that. Well, some people cannot go to work without the support. Like some people cannot keep a home, a place to live in without support because they don't understand how to do the paperwork. They don't understand how to balance their daily lives with work.
The contradictions are cruel. Work requirements for people who lose benefits if they work. Asset limits that punish savings, which could allow greater independence. A system that demands you prove you're sick enough to deserve care, but without being so sick that you can't navigate the bureaucracy. Here's what we know. Nearly half of all Medicare and Medicaid enrollees are people of color. More than 4 in 10 are in fair or poor health. Half of full-time benefit enrollees have a mental health condition. And in Kentucky, where Medicaid was expanded, the importance of greater coverage still meets the reality of provider shortages and systematic barriers.
They're us. They're not some other person who did something bad. They're us. They're all of us.
And they wonder why mental health issues and all of that are so high. Crime is up, whatever. I mean, it's back to the basics. You don't provide for people's material needs, then they're going to revolt. It's that simple.
But Jen refuses to accept this as inevitable. She shares information. She feeds people. She advocates. She survives. And she asks us to remember 2 things.
Kindness matters, and disabled people are adults who can speak for themselves and their needs.
This is what resistance looks like in the world of dual eligibility. Not simply marches or protests, though those matter too, but the daily act of keeping each other alive, of sharing a meal under an overpass, of spreading information like wildfire, of refusing to let friends fall through the cracks alone. Jen's fallen friends, John, Spike, and countless others, died waiting for care they were entitled to receive. They died because the system rations care through confusion, saves money through attrition, and balances budgets on the backs of people too exhausted to fight back. But Jen keeps fighting, not only because she has to, but because she knows what happens when we don't.
Because of the complexities of the system, because people are not able to access the care appropriately, people are dying while trying to get care. They think that's an exaggeration.
It's not an exaggeration. It's Kentucky. It's Georgia. It's the South. It's America. And until we decide that healthcare is a right, not an endurance test, people will keep falling through the cracks. But Jen, despite being exhausted and grieving, still fights because she holds onto a vision of what could be.
I believe in empowerment. I believe in, whatever is free should be free to give and free to use and whatever. And everybody deserves it because everybody needs the support.
That's the world Jen is building. One shared meal at a time. One piece of information spread like wildfire. One act of kindness in a system known for its cruelty. Join us next time as we travel to another state, meet another survivor, and continue exposing the true cost of care.
To learn more about Dual, the true cost of care, tell your dual eligibility story, or to get involved, visit dualcostofcare.com.